Dr. Jeffrey Sher is the Executive Medical Director and co-founder of SIRM, Sher Institutes for Reproductive Medicine. Dr. Sher is an internationally renowned expert in the field of assisted reproductive technology and has been influential in the births of more than 18,000 IVF babies. After training under the fathers of IVF, Dr. Patrick Steptoe and Robert Edwards, Dr. Sher established the first private IVF program in the United States in 1982. He later expanded his practice to include a number of centers throughout California before founding the first SIRM in Las Vegas. Dr. Sher has just recently been selected as Top Doctor of the Year for 2019 by the International Association of Top Professionals, IAOTP, for his outstanding leadership, dedication, and contributions to in vitro fertilization. With having over 3 decades of professional experience in IVF and being the founder in 1982 of the first private IVF clinic in the United States, he has certainly proven himself as an extraordinary professional, pioneer, and expert in the field. Dr. Sher is a dynamic, results-driven leader who has demonstrated success not only as a doctor, but is also an internationally renowned authority on immunologic and chromosomal causes of infertility, as well as recurrent pregnancy loss, and is a pioneer of many firsts in the field of IVF. His impressive repertoire of prior roles and accomplishments include being the first to recommend the exclusive use of gonadotropin fertility drugs to stimulate ovarian follicle and egg development for IVF. He was the first to introduce intrauterine insemination of processed and enhanced sperm for treating certain forms of infertility, the first to report on the ultrasound appearance and thickness of the uterine lining as a predictor of IVF success, and introduced prolonged coasting, a method that can prevent the life-endangering complications associated with severe ovarian hyperstimulation syndrome, OHSS. In 1994, Dr. Sher was the first to treat immunologic factors that often compromise the implantation potential of embryos used in IVF. He was also the first to demonstrate that the administration of sildenafil Viagra to women who failed to achieve success with IVF due to a thin uterine lining could rapidly reverse the problem and improve IVF outcome. In 1998, Dr. Sher recommended the selective use of immunoglobulin G for the treatment of certain forms of immunologic implantation dysfunction in IVF. In 2003, Dr. Sher was the first to measure soluble human leukocyte antigen G in the media surrounding early individual embryos and use this genetic marker to identify the best individual embryos for transfer to the uterus. In 2005, by using comparative genomic hybridization, CGH, for pre-implantation genetic screening, PGS, Dr. Sher became the first to demonstrate that embryo resulting from fertilization of a chromosomally normal euploid egg had a markedly improved ability to implant successfully and produce a normal baby. The subsequent proliferation of PGS to test egg embryo competence has since vastly improved IVF results, leading to a reduction in the number of embryos transferred at one time, and in the process has lowered the incidence of IVF multiple pregnancies. To date, more than 7,000 babies have been born using PGS to select the most competent embryos. In 2008, Dr. Sher became the first to apply full chromosomal PGS to the selection of normal eggs for freezing, cryobanking, leading to a significant improvement in the birth rate per frozen egg over that which had been previously reported. Dr. Sher received his medical degree from Stellenbosch University Medical School in South Africa and is MB-CHB, Bachelor of Surgery, Bachelor of Medicine, in 1968. Some of his prior positions included Assistant Professor of the University of North Carolina School of Medicine, Chapel Hill and Clinical Professor in Obstetrics and Gynecology at the University of Nevada, Reno School of Medicine. Dr. Sher was the Director of the Reno Women's Clinic, Medical Director of the Northern Nevada Fertility Center, and Executive Medical Director of the Pacific Fertility Medical Centers. Throughout his illustrious career, Dr. Sher has received numerous awards and accolades and has been recognized worldwide on television and has garnered extensive media coverage for his outstanding leadership and commitment to the profession. For 2019, he is being considered to be featured in TIP, Top Industry Professional magazine, and is also being considered for IAOTP's Lifetime Achievement Award. He was chosen as Top Doctor of the Year by the International Association of Top Professionals, IAOTP, and was recently recognized as Physician of the Year by several Las Vegas publications. Dr. Sher is an esteemed member of several prominent organizations, including elected Fellow of Royal College of Obstetrics and Gynecologists, Reviewer for Human Reproduction, member of the Steering Committee under the auspices of the American Fertility Society, Reviewer for the American Journal of Obstetrics and Gynecology, and on the advisory board for Conceive magazine, just to name a few. Aside from his successful career, Dr. Sher is an internationally sought-after speaker, presenter, lecturer, and published author. He has more than 250 scientific papers and abstracts to his credit, and has authored one of the most widely read consumer books on IVF, In Vitro Fertilization: The Art of Making Babies. Looking back, Dr. Sher attributes his success to his education, mentors he has had along the way, and his endless passion for helping his patients. He says his work is very gratifying and encourages others to consider a career in IVF. When not working, he enjoys spending time with his family, working out, and traveling. For the future, Dr. Sher says he will continue to push the envelope, always looking for new ways to help couples go from infertility to family, and to improve IVF outcome. In April 2019, he established Sher Fertility Solutions, SFS, a service that provides audiovisual, one-on-one online consultations to those with complex reproductive problems such as unexplained repeated IVF failure, recurrent pregnancy loss, RPL, age-related infertility, and immunologic implantation dysfunction, IID. He hopes that his research and continuous efforts will help couples fulfill their dreams of becoming parents. For more information on Dr. Sher, please visit www.drjeffreysherivf.com.